Emily Wadle, and I was in a group with Faith Arnold and Grace Vandewater, and our presentation is on aortic stenosis. Aortic stenosis is when a heart's aortic valve narrows or is blocked. This narrowing prevents the valve from opening fully, which reduces or blocks blood flow from your heart out of your aorta, and it really can affect systemic circulation. And most of the information that I got here is from the Mayo Clinic. Okay, so AS, or aortic stenosis, is caused by a few things. One of the biggest things being congenital heart defects. Generally speaking, it doesn't really affect children, but there are some children who are born with only two cusps on what is supposed to be a tri-leafed valve. And that doesn't really cause problems as a child, but when they become an adult, that's when it starts to present symptoms. And also, things that cause symptoms is as blood flows through the aortic valve over a lifetime, the calcium in the blood can build up on the valve, which can cause it to harden and calcify, which also restricts its ability to open. Another common cause of AS is rheumatic fever, which is something that follows strep throat a lot of time, and it can create scar tissue right in here, which means it can't close all the way properly, and it definitely cannot open all the way properly. So how do you know that you have AS? Well, some of the most common symptoms of AS, it needs to be noted, are not specific. They are symptoms that are for a lot of other diseases. And healthcare workers are very careful when diagnosing AS. Some of the earliest symptoms include exertional dyspnea or decreased exercise tolerance, which is like you become very dizzy when you exert yourself. Exertional dizziness or syncope, so that can include fainting, or exertional angina, which is chest pain. Later symptoms are very, very similar, but are more consistent and not just set on by exertion, which include syncope again, angina, and even heart failure. To be diagnosed with AS, a patient will come into the doctor's office and they will look for a few specific things. They will look for a low volume and slow rising carotid pulse in your carotid artery. And they'll listen for a loud mid to late peaking systolic murmur on the right intercostal space. And they'll also listen to your heartbeat, and there's supposed to be two sounds, a lub and a dub, but the dub is split into two different places in your heart. But they'll only hear one of those two little second sounds. And they can find most of these things by physical examinations. And if a physical examination cannot rule out aortic stenosis, then they will move on to doing some imaging, like an echocardiography or ultrasound, which is what is shown here. So this top one is what a regular aortic valve should look like. It's got 3 leaflets. And this bottom one is, and that's when it's relaxed, it's in diastole. This is a 2-leafed aortic valve in systole, so when it's open and letting blood through. Here's one, and here's the other. To treat AS, physicians know they need to act fast because this disease gives you about 2 to 3 years to live if it's not treated, and you're at constant risk of sudden death. So as soon as they see other cardiac symptoms presenting, they know that they're in the later stages of the disease and they need to act quickly. It's a progressive disease, and it moves in sequential stages, so by the time the symptoms progress to presenting clinically, they need to do something quickly. Most of the time, the immediate action would be to replace the valve, either with a mechanical valve or a bioprosthetic valve. Depending on the severity of the condition, They also have another option of using what's called a balloon vulvoplasty, where they insert a little balloon on a catheter in through a larger vessel and move it up into the heart. And up here, this picture shows what the valve looked like before the balloon vulvoplasty and the area that it could open to. A normal aortic valve can open to about 3 to 4 square centimeters, and that's not even close to that. But this is after the balloon has been blown up, and as you can see, it's gotten a lot of its function back. If the disease is not that bad and there's not very much blockage, then they'll just suggest some lifestyle changes for the patient. So without treatment, like I said, this disease gives the patient about 2 to 3 years to live and comes with a lot of negative side effects if it's not treated, which includes heart failure, pulmonary hypertension, arrhythmias, endocarditis, bleeding problems, and sudden cardiac deaths. When a valve replacement is administered, it adds years onto life expectancy. This is the highest cause of blockages in both children and adults. So younger patients do have to receive valve replacements as well. But if they do receive valve replacements, they are seeing years and years added on to their lives. And then in younger patients, they're generally going with mechanical valves versus bioprosthetics because they're seeing that they're more durable and can hold up longer. In older patients who also receive new valves are also seeing a great prognosis and have a good life ahead of them still after this disease. So that is all the information I have for you on aortic stenosis. Any questions?